This doctor performed surgery on himself more than once, all in the name of science. Keep watching to see how and why he did it, including self-surgery on his appendix.
The doctor and the patient were the same. He operated on himself.
The doctor is Dr. Evan O'Neill Kane, who's now well recognized for his contributions to the medical field. Evan belonged to a well-reputed family. His father was the American Civil War Major General Thomas L. Kane, while his mother Elizabeth was a physician, as were two of his siblings. Kane believed that some surgeries do not necessarily need general anesthesia. He demonstrated this by performing self-surgery in 1921 to remove his appendix under local anesthesia. However, this was not the first time. 2 years before, he had sliced off the index finger of his left hand after it developed an infected ulcer. Several reasons compelled him to attempt this.
Dr. Kane, in 1921, made an accusation that too many doctors were using general anesthesia and putting patients to sleep for surgeries that should be done with localized anesthesia.
Dr. Evan believed there was a way around it after the successful surgery on his finger using an alternative form of anesthesia, which had almost no side effects and effectively controlled pain. To prove the effectiveness of local anesthesia, he had to use it during a more complicated surgery. Fortunately, there were few volunteers for such a procedure. 60-year-old Evan Kane solved this problem by himself. He lay on the surgical table, propped up by pillows, head supported by a nurse, and performed his appendectomy under local anesthesia. 3 other surgeons looked on as he made a large incision in his abdomen using a scalpel and closed off blood vessels as he progressed to deeper layers. Once his appendix was out, the other surgeons, including his brother, Dr. Tom L. Kane, stitched him back up again. He survived the experience and recovered completely, as he was already suffering from chronic appendicitis. These anesthetic agents were then used more frequently, leading to safer operations and more people qualifying for more comfortable and life-saving surgery. In 1932, at 70 years of age, he again performed self-surgery to repair his hernia, which is an area where fat or tissue pokes on through the abdomen muscular wall. This procedure was a bit riskier, but he finished it successfully, and in less than 2 days, he was again in the operating room carrying out various surgical procedures on others. After this event, Evan was all over the headlines and the topic of conversation in the media. Kane's son, Alicia, was charged with murdering his wife, Jenny, drowning her at a beach at Chesapeake Bay. The trial was a sensation and crowds gathered outside the courthouse. Evan Kane was instrumental in obtaining his son's acquittal by presenting medical evidence at his trial, establishing that Jenny had a heart condition that contributed to her drowning. Following the hernia repair, his health never recovered to what it once was before the operation. He died only a few months later, 5 days before turning 71. Dr. Evan not only practiced medicine, but also contributed to innovations in surgical procedures and equipment throughout his life. These included asbestos bandages, mica windows for brain surgery, multiple site hypodermoclysis for administering fluids in the body, and acetylene lamps intended for operations carried out in the field at night. Dr. Evan would also play music during his surgeries, which he believed would help calm the patients and reduce post-operative pain. He improved medical care for many, and his ideas appeared in a television series called The Nick. Dr. Leonid Rogozov was a Russian physician at an Antarctic research station and developed appendicitis. Left with no choice, he did what Evan had done and saved his life by performing his own surgery with the assistance of meteorologist and a mechanic. It is rare to find such examples in history where a doctor would risk his life for his patients and the betterment of healthcare. We hope you enjoyed this amazingly inspiring story. Stay tuned for more.